Hi, everybody. I wanted to take this chance to go over a recent example of a mucosal immune reactivity screen that I did for a patient. This just happened last month. This was for a 4-year-old, a young girl who had been complaining to her parents about a lot of intense abdominal pain. She was always complaining about stomach pain. Anytime she would eat, her stomach would hurt. Um, and it was just it wasn't getting any better with any of the traditional things like probiotics or massage or allowing her to relax. So, given the fact that her uncle had a history of Crohn's disease, which is an autoimmune inflammatory condition that affects the digestive tract and is a reaction typically to some sort of microbe or something that the body's ingesting, creating a lot of inflammation to the point where you can even develop ulcers or perforations in the intestines, and the fact that the little girl's mother also suffered from digestive issues, including SIBO and constipation, they opted to do the mucosal immune reactivity screen. So basically, what this is a sample of saliva. It's about 4 milliliters, so quite a bit of saliva, but it tests to see if there's any antibodies to a bunch of common causes of inflammation from the diet and in the digestive tract in the saliva. It can be very helpful for people who are worried about autoimmunity, like Hashimoto's, inflammatory bowel disease like Crohn's or colitis, really any sort of autoimmunity, or if there's a history of leaky gut, intestinal permeability, to try and catch that and see what might be causing issues. Because the mucosal immune system, which lines all of our mucous membranes in our skin, in the sinuses, the digestive tract, the mouth, in the genitals, this helps protect us as our first line of defense from injuries or infections or insults like pesticides, heavy metals, or really pro-inflammatory foods. So thankfully for this little girl, none of the tests came back positive, so we were able to rule out that she had any mucosal damage going on. It turned out later that this little girl had a parasite in her stool. She had pinworms. So she ended up getting parasite medicine and her stomach pain started to resolve. But I'm really glad that we ruled this out given her family history and the fact that her uncle, who also had Crohn's disease as a child, went for years and years complaining of his stomach pain before it was finally determined what was going on. So I just wanted to go over some of these tests. You can have an idea of what these sorts of things are testing for. So total secretory IgA. This is an antibody produced by the immune system in the skin and the mucosal linings of the body, like the gut, the sinuses, the genitals, that helps to prevent microbes like E. coli, parasites, etc., from adhering to the lining of the intestines. So they basically can't stick to the gut and they slough off in the stool. This is also produced in things like saliva, tears, or discharge and mucus from the vagina. Lipopolysaccharides, this is a toxin found in certain bacteria, gram-negative bacteria, that the immune system recognizes. And because the immune system recognizes this, an endotoxin that is found in a lot of common bacteria like E. coli. Because the immune system recognizes it, it causes inflammation. Now, something I like about Cyrex tests is that they test both the IgM and the IgA antibodies. IgM is the first general response the immune system creates to a new exposure of some kind, and then IgA is in particular for the mucous membranes like the gut, the mouth, etc. When LPS can get through a leaky gut, if the mucosal lining is broken down and leaky, then the LPS can create a lot of inflammation and are implicated in all sorts of things like arthritis pain and neurodegenerative conditions like Parkinson's and depression and Alzheimer's. Occludin and zonulin, this is a protein that is very important for the gut lining barrier and the blood-brain barrier. Um, well, this is more specific for the gut. They have a blood-brain barrier protein down here as well. So generally speaking, if you have a leaky gut, then you're much more likely to have a leaky brain as well. So they like to test both of those. If zonulin is elevated, that's a sign that you probably have intestinal permeability or leaky gut. Actomycin, this is an antibody that can affect muscle tissue. ASCA and ANCA, these are antibodies to common yeasts, brewer's yeast, Candida, Saccharomyces, and both of these antibodies are typically found in inflammatory bowel disease, Crohn's and colitis. Calprotectin, this is produced by white blood cells and is often a marker of inflammation. In people with Crohn's or colitis or other inflammatory bowel diseases and digestive dysfunction, this is a measure of how inflamed the gut is. The next few tests, these are all different parts of gluten-containing grains, wheat, barley, rye, because the most common one to test for is alpha-gliadin, that you will see with most food sensitivity testing, this type of testing. But there are a whole different variety of antigens, proteins that can create an immune response. And is one of the reasons that I recommend for most people, even if you're not celiac, even if you don't have gluten intolerance, if you're worried about digestive dysfunction, if you're worried about intestinal permeability, if you're worried about a leaky gut, a leaky brain, then just stay away from gluten because it can create leaky gut by releasing zonulin, even if you're not sensitive to it, even if it's only transient. Especially important if you have a history of multiple concussions, like if you played football or hockey or boxing, and you have multiple concussions, because things like gliadin, gluten can create a leaky gut, a leaky brain, and inflame the brain all over again. They also include antibodies to some of the most common foods that people have inflammatory reactions to: egg, soy, corn. Growing up in the Midwest, incredibly important to test both of these. When I was growing up in Wisconsin, basically all around my little town for 8 miles in every direction was nothing but corn and soybean fields. So if you are intolerant of those two or they created inflammation, that could be a big problem living somewhere like that. Alpha beta casein, these are proteins found in dairy products as well as casomorphins. Aflatoxin, this is a toxin produced by certain types of mold that is very common to find on foodstuffs like corn flour or different types of grains and flours you can find in the grocery store. Bisphenol A, BPA, this is an endocrine disruptor that's found in a variety of different types of plastics or thermal paper from receipts. When you go to a store or a grocery store and they give you a receipt, don't handle a receipt for longer than 30 seconds, or some of the BPA and other toxins in that thermal paper can leach into your skin. They test some heavy metals, some of the most common ones, mercury. There is no safe amount of mercury in the human body. There is no lower tolerable limit, which is one of the reasons why I recommend people don't eat tuna fish more than once a week. Even if you get it from a good brand like Safest Catch, which tests each individual fish for mercury levels. If you're eating tuna more than once a week, you're getting, more mercury each time. And it's hard for the body to bind that up and get it out of the system. They test other heavy metals as well. Rotavirus, which is a virus that can cause havoc in the digestive tract. Myelin basic protein, this is a protein that surrounds the nerves of the human body, so it allows for proper conduction of those nerve signals when we're synapsing either in the brain or in other peripheral nerves. The myelin basic protein antibody response is very common in neurodegenerative conditions like multiple sclerosis. As I was saying before, they also test for blood-brain barrier proteins, similar but not totally the same as some of the proteins found in the gut lining. But as I said before, generally speaking, if you have a leaky gut, you are much more likely to have a leaky brain. So, for example, say you have a really pro-inflammatory Western diet, you eat a meal that's high in fat and or carbs, like a bunch of potato chips. The endotoxins, the lipopolysaccharides from the gram-negative bacteria, will hitch a ride on the what is it called? The fatty acids from that high-fat meal, which will enter your bloodstream and your lymph and go systemic. And when that happens, then you can create inflammation in the blood-brain barrier, developing a leaky brain. And when those endotoxins get into the brain tissue and cause inflammation in the brain, that's when people develop symptoms like depression, anxiety, and are even implicated in things like Parkinson's, Alzheimer's, and Huntington's. So if you eat a fatty meal and feel kind of depressed and low afterwards, that could be a possible reason why, as well as immune complexes in general to see if the body is producing a lot of inflammatory response to this. This can be related to C-reactive protein, which is a protein that's activated in response to any sort of damage or inflammation in the blood vessels. So if you get a cut or if you have a condition that irritates the blood vessels, like type 2 diabetes, where there's too much sugar zooming around in the blood, or really high blood pressure and your CRP can be elevated, you'll also be getting more response to immune complexes in many cases. So I hope you found that informative. The reason that we like to test the mucosal reactivity is to see if the first barrier of defense in the body, the mucosal lining, is defective, dysfunctional, because that can lead to all other sorts of things like food intolerances, autoimmune diseases, and systemic inflammation in the brain, joints, or other areas that are really far away from the gut lining, the sinuses, or the genitals. All right. Thanks so much.